Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio Deborah Omage. Deborah Omage is a program associate for mental health, Nigeria Mental Health, an organization that is concerned with mental health issues in Nigeria and how to help the millions of people that are suffering mental health issues, and how to coordinate the various interventions of various professionals and groups and associations of mental health in this country. Deborah, you're welcome.
Thank you very much, sir.
You are working with Nigeria Mental Health, working closely with Chime,
Yes,
Asonye, and what do you people do with regards to mental health? Nigeria Mental Health, what do you do?
Okay, so Nigeria Mental Health is the country's largest multifaceted network, leading over 50 mental health organizations.
So it's a network?
Yes, sir. Leading over 50 mental health organizations in the country, bringing about change in the mental health space, especially with regards to policy reform, disability inclusion in mental health, as well as peer education for the public.
So you say that you're networking with over 50 mental health groups and whatever. Can you name some of them?
And we have ASIDO Foundation, we have MANI Nigeria, we also have ASADS, that's Anti-Suicide and Depression Squad, amongst some other of them.
So are you do you work closely with the Nigeria Psychological Association, Nigeria Psychiatric Association, these professional bodies? Do you work closely with the actual professional bodies?
Yes, we do. And also we work closely with the Suicide and Prevention Working Group in Nigeria as well.
Okay. Yeah. So what are the kind of statistics you have with regards to mental health prevalence in Nigeria, and from what sources have you gotten your statistics?
Okay, so I would start with World Health Organization, which is a leading body for mental health internationally. The latest statistics that I have as of the last time we checked was in Nigeria, about 20% of the population go through one form of mental health condition or the other. That translates to about 40 million Nigerians. And the most common of these conditions are either depression or anxiety. And with regards to the workforce, we have, according to the Association of Psychiatrists in Nigeria, we have just about or fewer than 300 psychiatrists attending to over 200 million people.
That is psychiatrists?
Yes.
But I hope you know that clinical psychologists deal with people. Psychiatrists are people who deal with people at the very end, meaning people who have broken down completely.
Yes.
But you have psychologists and clinical psychologists who work with people with various degrees of mental health challenges before the thing gets to the point of seeing psychiatrists.
Yes.
So if you have 300 psychiatrists, well, that's not a huge. We actually have thousands of psychologists. Are you in touch with some of these or their organizations? Okay,
so I would say that the leading organization which we know that has to do with trained professionals in the mental health space is the Association of Psychiatrists in Nigeria. And so that's why we can get our statistics from them.
What I'm trying to say is that so you know only one, because you see, if you are talking to clinical psychologists now, they won't agree with you that the leading organization. Reason is that if you go to every teaching hospital and every federal medical center, you have clinical psychologists who are trained to handle mental health issues.
Yes,
so if you stay only with psychiatrists, well, that's just one set of professionals.
I agree.
So you talk about 20% of the Nigerian population. What figure do you have from the Nigeria Bureau of Statistics? Because, World Health Organization is one foreign body.
Yeah.
But what about, do we have any statistics in Nigeria?
I can't pinpoint it or say, yes, this is it, because
maybe you guys have to find out.
Yes, I agree. Data is still very much fragmented in this country, especially with areas like mental health, which is still coming into the limelight. So I wouldn't say that I have hands-on figures of this is what it is, according to the Nigeria Bureau of Statistics.
Now, so you have a network of organizations that you are in touch with So on a daily basis, what do you do? I know that things like policy reform, let's say to decriminalize suicide, for example. I know that your organization has been highly involved in that. So what other things do you do?
We organize online events as well as offline events. For example, we work together to ensure that we bridge the gaps between distress and care available for the people. That is, for example, what we've done with the National Mental Health Directory, which we have put together. Now, it was worked on by Nigeria Mental Health as well as the network and some other organizations that...
You now have a directory?
Yes.
Where is it available?
It's available on our website at nigeriamentalhealth.org under the page Mental Health Support. The directory is a list of centers, in-person centers, where people can visit to take care of their mental health and just assess the help that they need.
Okay, so if we go to nigeriamentalhealth.org,
yes,
we will find a directory.
Yes.
Showing facilities.
Yes, sir.
Available.
Yes, sir.
Across the country.
Across the country.
Is it comprehensive?
It is comprehensive.
Do you know the facility in my village?
It's a living project, that I would say. So we will continue to populate it. Yes,
so when
sir.
I give you the one in my village, you will add it.
Exactly.
Okay.
So long as we're able to verify it, call the centers and they say yes, they're here, this is their location, this is their address, we would add it to the directory.
So this is what type of facilities? Because when it comes to mental health, you have the orthodox mental health institutions, but also you have the supporting mental health institutions, traditional. And they too are doing some work in that area.
Yes, sir.
Not to talk of some spiritual ones. So this is limited to the orthodox medicine ones, right?
I wouldn't say so. So the organizations or the centers that are in the directory, some of them don't tend to just orthodox medicine. Some of them go ahead to do spiritual aspects as well. So it's just a holistic directory all the same. Yes.
Okay. So does your directory also have a list of the professionals?
The list of professionals.
The professionals that help in mental health area.
No. It just lists what is in the directory, the names of the centers, the kinds of services that they provide in relation to mental health, their address, the states where they're present, the number of hours which they're open. Some of them are open for 24 hours. Some are opened on specific days. And another thing that we have done with respect to mentioning that it's a living project is the comment session where people can, we've opened it up to the public so they could always give their feedback even when they visit the centers.
Or mention the fact that, I have some issues. Which center should I go?
Yes, sir.
Oh, okay. Okay, that's a good one. So what kind of activities do you have or have you engaged in through the month of May as part of the Mental Health Month sensitization, public awareness, policy advocacy? What kind of activities?
I would say the major one which we did is the launch of the National Mental Health Directory. It took a rigorous process of planning, coming together, bringing... the event happened on Wednesday, the 28th of May. That was about 2 days ago. And what we did was we gathered we got together key hands from different areas, including government, civil societies, and the entire public. We had the keynote speech from Senator Asukwo Ekpenyong. We brought on the entertainment space, Banky W. We had Titi Tade from Shopping. We also brought on the National Mental Health Coordinator, Dr. Tunde Ojo. So that was the major event which we had that we have brought in the limelight of the public in the month of May.
And you are at the center of putting this together, or coordinating that event.
Yes,
of the 28th of May.
Yes,
okay, so launch of the directory. So going forward, what's the organization's next area of focus? I know you were before now. Your organization took on seriously the project of seeing to policy reform with regards to decriminalizing suicide.
Yes, sir.
In the last 1-2 years, that was the big events. Your events were around that.
Yes, sir.
Okay, so your event this year was on launch of the directory.
In the month of May.
In the month of May.
Yes.
So going forward, what are your areas of focus and attention?
Moving forward, we're still on the line of Suicide Not Crime campaign, which is the trying to push for the decriminalization of suicide in Nigeria. It's still an ongoing process. Also, we're moving forward to push for the creation of the Department of Mental Health within the Federal Ministry of Health, and basically we still have other areas, so I would not be able to say this is it.
Are you insinuating that there is no Department of Mental Health in the Federal Ministry of Education? That's the Federal Ministry of Health?
Yes, at the moment there's none, but we're hoping that it would happen.
So where are issues of mental health domiciled? Is it a public health unit? Because the Federal Ministry of Health recognizes that there are mental health issues they need to respond to.
Yes.
So which department, which unit responds to it?
We don't have a department now. We just have a point person, which is the National Mental Health Coordinator, and is treated as a public health issue within the Federal Ministry of Health.
So it is located in a public health department.
Yes,
I see. So what your organization is pushing for is that there should be a department, a directorate, as it were.
Yes, sir.
I see. For mental health.
Yes, sir.
I mean, for me, that should be long overdue, because aren't you also pushing for budgetary allocation for such a department? Because from what I know, there's very little that comes in terms of budget for mental health care in Nigeria.
Yes.
From what
yes,
I know.
You're correct. Pushing for the creation of the department will actually cover these issues that you've mentioned, including funding, the issue of poor infrastructure, and even in terms of having more trained workers to attend to the needs of the population when it comes to mental health.
I actually think that we have, apart from psychiatrists,
Yes.
that we have a lot of psychologists in this country, including clinical psychologists, but who are not engaged in mental health work. We have psychologists who are engaged in corporate organizations, not even in the human resource unit, because they read psychology and the society does not appreciate the issues of mental health. I know that there are thousands of people who have studied psychology in this country, between the University of Jos and University of Ibadan and University of across the various University of Nigeria, Nasarawa State University, where for the past 30-40 years they have been producing psychologists and training professionals like clinical psychologists. But many are not engaged in that area. We here at Terra, we are training professionals. We are training psychologists, we are training people in trauma healing, psychotrauma healing, postgraduate diploma. We are training people master's degree in psychospiritual therapy. And all these people are supposed to work in the mental health area. That's why when you mentioned 300 professionals, I told you that you're only looking at one angle of the mental health ecosystem.
Yes,
that there are many professionals in the mental health ecosystem. It is when people literally, get to a point of breakdown, as it were, that you now refer to a psychiatrist. When they need medication, when they need drugs, when they need to be, but the kind of people we train here are the kind of people to help people deal with trauma.
Yes.
So that it does not end up in post-traumatic stress disorder, complicated
issues.
To deal with people who are getting into addiction, including internet addiction, pornography addiction, and all kinds of things that will end up making them terribly sick in future. To help people deal with crisis, bereavement, and all those things. Many of those don't need psychiatrists, but they need mental health workers.
Yes.
So that's it. I would want that you tell your boss, you tell Chime that you need to acknowledge all this and not just focus on psychiatrists. Then there's a group like MASHI. Have you heard of MASHI?
I'm not sure I have.
Mind and Heart Helpers Initiative. I'm on the board of that organization,
Okay.
and it brings together a number of mental health workers, and we have a platform, and then there are hundreds of people who are. As soon as we hear that somebody has issues, somebody in the platform says who is near this person and who can be of help, and so on and so forth. And there are people, experts from across the world, that are part of that network. So I would wish that Nigeria Mental Health considers itself like an umbrella network group, and any group you hear is doing something in the mental health area, please reach out to them.
Yes, sir.
That's what I would recommend.
Okay.
So, having done the launch of the directory, you said that you are going to continue. Okay, it's a live directory. You're going to continue to update.
Yes, sir.
And you're going to continue to push for decriminalizing suicide
in Nigeria.
Okay. Then you mentioned what? The office, the department.
We're also pushing for the creation of the Department of Mental Health within the Federal Ministry of Health.
What kind of network do you have within the federal government? What kind of network do you have? What connections do you have? Who and who are helping you to push these issues?
Which of these issues now? Let me be
Any
clear
of these, whether it is decriminalizing. Okay, decriminalizing, you need this, the parliament for that. Opening department, starting a department, you need somebody in the Federal Ministry of Health.
Yes. So currently we've started talking with the national coordinator for the mental health program, excuse me, within the country, that is Dr. Tunde Ojo. And we're hoping that this was also brought to limelight again. We had this discussion about it during the launch event. We're hoping that post-event we would sit more proper on it and see what can be done to ensure that this department is created.
Don't you think that we need to go a bit higher than the coordinator of mental health? I mean, this is something that should require, it's a ministerial level decision. So I guess that you guys need to work, to reach higher actually to the literally level of the presidency through the minister for this kind of department, and then I know that some work is going on at the parliament, right?
Yes, sir. I agree with you. But then again, starting Dr. Tunde Ojo is first of all the point person. That's the person recognized as the mental health coordinator. So that's why I say we're starting with him.
Yeah, I started with him, but I'm saying that if you need to create a department,
yes, we need to go
in
higher.
Mental health, you definitely need to go higher.
Most definitely.
That's the point I'm making.
Most definitely.
And then maybe my suggestion is, like I said, one, spread your net wider than psychiatrists as professionals.
I agree.
Because the people I work with a lot are clinical psychologists and psychologists. And they don't agree that just focusing on psychiatrists.
Okay, so I would say that is very much noted. But I think that with respect to having a particular number of them, would you say you have the particular number? Maybe if we could get that information from you, it would help us.
I will link you with the Nigerian Psychological Association.
Okay.
They have a long list of people. Nigerian the people who are registered, licensed practitioners in clinical psychology, they have it, you know. And then in the psychological area, you also have a lot of professionals. We have organizational and industrial psychologists. You have all those kind of professionals in this country. And I think Nigerian Mental Health should
collaborate with them.
Yes. Okay. Take note of all that and collaborate with them. So, what do you have to say to Nigerians about where we are today in terms of the mental health of Nigerians? The average Nigerian, you talk about 20%. So, what's happening? I believe it's a lot more. Why? What's happening in Nigeria?
I would say that there are a number of factors, mostly being the current economic state. Also with terms of instability, thinking of financial instability, for example, job instability, the rising cost of things in the economy altogether. These are contributing factors to where we're at currently, the rising issue of mental health conditions or problems in the country. So I would say that yes, indeed, the issues are growing, and we still the conditions are increasing with people, and we also have the issue of stigma, which stops people from getting the help that they need. Because in as much as yes, mental health is coming into the limelight in the country, it's still very much a stigmatized topic in some areas. So we have both issues working hand in hand, but I would say that for Nigerians, having a mental health condition or going through a mental health issue is not the end of the world, and it's not something to be ashamed of. You need to understand that just as much as you go through one physical condition and you choose to get the required help that you need, it's okay to get the help that you need when it comes to your mental health. You get better and you go on with life.
You have just mentioned stigma. So what is your Nigerian mental health doing to reduce the stigma that is associated with mental health? Because you have mentioned a lot of mental health people, a lot of people with mental health issues don't come out, don't seek help because of the stigma associated with mental health. What programs or what possible programs can you people put together to reduce this stigma?
We could do more of public awareness, which is something we already do. Continued, I think that is the first point, and public awareness as well as mental health literacy, knowing or allowing people to know that yes, these things exist. It's not a topic that should be stigmatized. In addition to that, what we're doing is the putting together of the directory, which I had mentioned earlier. Now, putting together that directory ensured that we let people know that centers are available, they are visible. Visibility basically saves lives, which is something that we're trying to push across by putting together that directory, knowing that, oh, it's not a hush issue that you have to talk about or go to a secluded area to say, okay, where do you think I can go to for help? So putting these things out have ensured that people now know that it's in the open. And if it's in the open, it shows that it's not something to be ashamed of. So these are some of the things that we've put together. And also, another thing we're doing is the pushing of decriminalization of suicide in Nigeria. By pushing that, we are letting them know that...
I think some states have already kind of decriminalized suicide, isn't it, in this country? Lagos, with those states? Yeah, there's some progress has been made by some states. I think Edo State, Lagos State, only that Lagos State mandates hospitalization for people who are sick, but for people who attempted suicide, there's a mandating something similar with Edo State. So it is for more states to go ahead and do something about and that.
Act accordingly.
Yes. Okay. So you are a young person. Right now in this country, we have something like an epidemic of addiction among young people. In the universities, outside the universities, in the motor parks, everywhere, a phenomenon of illicit drugs. Both the expensive ones and the cheap ones, the ones that they put together themselves. How do you think we can deal with this problem? It's a serious problem.
Yes, sir. I would start by saying that one, literacy, mental health literacy, mental health education. Why would I say that? Being that going or resulting into substance use most times is a form of coping mechanism, or as a result of pressure that has been put on them from their peers. Maybe, oh, just try this, and then eventually they get started and can't stop. So I would say public education, taking it not just at maybe general levels, but taking it to the grassroots level, taking it to the schools, to the point where we can meet the young people, which is in schools, in communities, in faith-based institutions as well. And also putting together or ensuring that at their points, that is wherever they may be in their country, in the environment, in immediate environments where they find themselves, there should be help available for them. So for example, let's talk about counseling services or guidance and counseling staffs in the universities or in schools or wherever. It should not just be in some schools, we hear of them, but we never see them. They have a guidance and counseling office that has been locked for so many months. People don't even know them. There are people that may be willing to actually go there to get the help that they need and say, okay, you know what? Yes, I'm struggling with this form of addiction, maybe substance abuse addiction, and I want to get help or talk to a psychologist about it or talk to a counselor about it. But the point of help or the people that they need to get this help from are not readily available in the environments where they are commonly found.
I think we have a major problem in our secondary schools because for many of them, these problems don't start in the university, already started in secondary schools. And the professionals we have in the secondary schools are more of career guidance counselors rather than proper counselors that can help in those problem areas.
Yes, sir.
So if somebody did career counseling, which belongs more to education, may not be able to help the kind of situation you are talking about.
Sure.
And in most of our schools, those are the kind of professionals we have.
Yes.
We here at our institute want to bridge that gap so as to train more people to be able to help in those schools. But across the country, the need is enormous. Then in the universities, what's your experience in the universities about what do you call the office? Is it, what do you call the office in the universities that deal with counseling of students?
The
Student affairs?
Probably student affairs. I think it's peculiar to different institutions. Yes.
But it belongs to student affairs.
Student affairs.
Do you think, you are saying that some of those professionals are not readily available?
Correct.
I'm even wondering to what extent each one of these universities has a proper department for mental health. Because if many universities don't have, then it is a major failure. It's a major gap that needs to be filled because young people are going to the university with numerous problems, psycho-emotional problems. So your organization has a lot of work carved out for you because just to take the campaign and the advocacy to have mental health awareness in universities alone, that's a lot.
Yes, sir.
To have departments in the universities, in the student affairs offices, where professionals are available for any student that is in crisis and needs to see an expert. That's a lot. With almost 300 universities in Nigeria.
Yes.
So the conclusion is that mental health is a much neglected area in Nigeria. And the truth is that aren't we all vulnerable to mental health breakdown? All of us. Are we not all vulnerable?
Yes, we are, actually. Mental health is a part of overall health. And health is not complete without mental health. You cannot say that someone is whole or healthy altogether without by excluding the area of mental health. So we're all vulnerable to it. First of all, it's a part of our health generally, whether in a state of complete well-being or not in having a breakdown mentally. So yes, we're all vulnerable to it. It just takes a particular trigger or a particular situation to bring us to that point of not being well mentally.
Well, and even there are people who even argue that mental health is a spectrum. So there's hardly anyone who we can say is 100% mental health well.
Yes.
So if it's a spectrum, it's just that the people at the far end of the spectrum end up with a psychiatrist in the hospital. But there are many of us who are going around in suit and tie or in gele or whatever, who are struggling with grief disorder, struggling with one addiction or the other, struggling with issues of trauma, childhood trauma, all kinds of things. Unfortunately, the attention in this country is still so poor that we all have a lot of work to do.
Okay.
Well, what I want you to face the camera and address young people. Say a few words to young people about the reality of mental health issues in this country and what each person must do to avoid breaking down. just directly to young people?
Okay, so I would start by saying I'm a young person like you, and I understand the struggles that we go through, especially when it comes to our mental well-being, knowing that we're very much still in a society that don't listen to us, especially when we come up with the topics of mental health. But I would like to say to you that it's okay to go through one mental health condition or the other. It's okay not to be okay. And it's okay for you to seek the help that you need. However, you have to learn to speak up. You have to learn to open up. Your voice is your strength when it comes to your mental health. You should be vocal enough to say, this is where I am at, and this is the help that I need. You should also be able to find the required help that you need by starting with a community, the direct community in front of you. And if your community around you is not helping, don't be afraid to go outside of your immediate community to get the help that you need. Take care of yourself. Look for healthy coping mechanisms. Take a walk. Start therapy. Start journaling. We're in this fight together, and you would get better with time.
And then your mental health directory now, that they can go.
Most definitely. In case you're in need of help and you want in-person help, you could check our directory. It's live at nigerianmentalhealth.org. All you have to do is search under the page Mental Health Support, where we have the directory. You can search by state, by location, kind of services that you want. And to complement that, in case you want to stay anonymous but you still need help, we have helplines that are on our page as well, still under the page Mental Health Support. Get there, get the phone numbers, and get the help that you need.
Great. So on this note, we'll be bringing this program to a close. I have been speaking with Deborah Omage.
Yes.
Deborah Omage, who is program associate with Nigerian Mental Health, and we've been discussing the recent launch of the Nigerian Mental Health Directory, which she said is domiciled on their website, nigerianmentalhealth.org, where you can actually see mental health facilities across the country. About how many are there?
There are about 49 in number at the moment.
Only?
That we've been able to gather.
Those who have been able to gather.
Yes.
I give you guys more work. You need to do more work because there should be a lot more.
Yes, sir.
A place like Abuja definitely has more than 10 facilities, right?
Yes, sir.
So Lagos should have a lot. I mean, apart from the big names, Yaba Psychiatric Hospital or Neuropsychiatric Hospital in Abuja, there are a lot
I agree
across the country.
And that's why there we have a form as well, a feedback form where people could submit centers that you want us to add to the list. All you have to do is fill the short form. We'll get the information there, try to contact them, verify it, and update the directory.
On this note, I want to congratulate Dr. Chime Asonye, your director, and all of you staff of Nigerian Mental Health who are working. You don't get any budget from federal government. You don't get any subvention from the federal government. Or any agency in Nigeria for that matter. But personal efforts and so on, you people are working hard. So congratulations. And we pray that Nigerians will begin to appreciate the importance of mental health and integrate it to the overall discussion about health, so that the kind of things that happened recently when a young girl took her life for not getting the marks that, for me, that shows the level of mental health in this country, because that's too small a reason. I mean, you may not pass JAM, but you can still live a very successful life. Sure. So that's two reasons. It just shows the level of mental health in this country. Very, very poor.
Yes.
Otherwise, why should an 18-year-old think that the solution for the embarrassment of my failing work is to kill myself?
We agree.
And the failure of the system
altogether.
Yeah, so she could not talk to anybody who would have advised her against it, who would have encouraged her that she could resist the JAM. 2, she could do a lot in life without JAM, without whatever. And we just pray that we don't see that kind of event again.
Amen.
Thank you very much, Deborah, and God bless the work you all do.
Amen. Thank you, sir.
Thank you.